the second part of the behavioral is behavioral problem اللي هو the second part of the school health is the second part of the school health. Antisocial problem. This is called can be as stealing, where the student can be thief or take other thing from their colleague, okay, or lying, cannot tell the truth, or offense, hit the other pupils, okay, that be aggressive, they be agitated. This can be antisocial problem, can call antisocial problem. زي the behavioral problem اللي هي habit disorder. This can be like nail biting. One student can eat their nails, okay, or thumb fucking, or bed wetting, which is called aneurysm. One of the common problem of the children اللي هو night bed wetting. طيب the other behavioral problem اللي هي personality disorder. This can be angry. The child always angry, always complain, always she weep or she crying. This is one of the personality disorder. Also, one of the personality, the baby can be shying, cannot face their colleague, cannot face their parent, cannot interact face to face with the other. Okay, this is the shy pupils or the shy student. All can be jealousy بالعربي معناه قيرة. كويس. A baby a child have a jealousy for their other colleague. The behavioral problem can be educational disorder. As the school fear. There is many students from the early morning they are cry, they are not want to go to school, they are not want to face the teachers, they are not go to teach in the outside the home. This is called school fear. This is an abnormal thing for the pupil or for the student. في اللي هي backwardness. The student have bad idea, have a bad experience in the house, in the school, bad experience in school. The other student hate them, the other student يعني the other student they cannot take alone, they cannot be a success, they are not take him. يعني بمعنى تنمر، انه الطفل بيتعرض للتنمر. انا ما لقيت الترم المناسبه للتنمر، بمعنى انه الطفل يتعرض للتنمر في المدرسه. بعد ذاك عندنا السكول فيلير. The student cannot able to continue in their education. This is one of the behavioral problem. Who is the school health team? What are the health team? A school health team composed of what? The personnel work in the school health team is the school principals, school teacher, the principal اللي هو the administered personnel. The school teacher, it is clear, the parent, okay? The community اللي هو committee of the school. Committee of the school. Okay? اللي هم the children which learn at the school. اللي هو the pupils, the medical officer اللي هم the other administrator as the hospital اللي هو ممكن يكونوا المحاسب، ممكن يكون الغفير، ممكن يكون اللي بيقول على شنو تحت التغذية، ممكن يكون السايكوثيرابيست وهكذا. تمام. برضو بيكون شنو يا اخواننا the important person in the school اللي هو the school health nurse ولا community health nurse ولا الدكتور in the school. كويس؟ دول all as the team of the health school health team. The school teacher. The school teacher. طيب. The school teacher اللي هو daily inspection of the children for the person hygiene and cleaning. This is one function of the school teacher. Must do. This is I'm not saying this is done today because the teacher have many activities and many responsibilities. I think so. It is rarely to do in the school, and there is a rare need in spite or exactly in the town or in the urban area. May find it rarely in the rural area, or in the camp. We can find that there is a defective in the personal hygiene. The other function of the school teacher اللي هو daily observation in the children for detecting any evidence of any deviation from the normal health behavior, any communicable disease and malnutrition. This is mean the teacher must be a good observer. This good observation help the teacher to detect any abnormal health symptom or abnormal health sign or abnormal behavior or any communicable diseases that can be appear. This is must be by the school teacher. بعد ذاك the other function of the school teacher إنه help in communicable disease control. Help in communicable disease control. When we say the communicable disease, we mean that this disease can be caused by a germ or by the organism and can be transmitted from the person to another person. The other function of the school teacher اللي هو referral of the children having any problem to the school health clinic or further action. She put or she write her observation, كويس, and go to transfer the student for the other clinical help or for other help outside the school. Also the function of the school health is to inform the parent and maintain follow-up. Inform the parent about what appear for their children or their kids in the hospital, if it be a health problem or be behavioral problem. The teacher must inform the parent of the student. Maintain record and measurement and other health record of the children. The teacher must have a record about the children اللي هي interim record اللي هي interim examination. Okay, and in this record any chronic diseases, any abnormal habits, abnormal attitude can be written in this record and saved for it can be secondary data for the student. Also can help in providing safe environment sanitation. I told before about the environment. The teacher must be sure that environment is safe for all components of the environmental health is safe for the children. Giving first aid and emergency to the children. This is mean that there is emergency can be appear through all the day. The student if injured, if have a cut wound, if have fracture, if have epistaxis, if have hypoglycemia. This is only teacher can face this problem in the school. For this reason, the school teacher must have must have a course about the first aid and emergency to save or to face this problem which may arise through the day in the school. The other person اللي هو the parent of the children, they can help in correction of defect of any and follow up of the children found sick. هم the main caregiver for the children. They are correct or can give a major help in correction of the health problem for their children. Also the parent can help in the information of good healthful living habits and behavior. Yes, this can be provided by the parent. The parent can provide a healthy house, can provide can learn the child to adopt a good habit and to adopt a good behavior. Part of the function of the parent is through parent teacher association. The parent can involving in planning, organization, and implementation of the school health program. Yes, this is which is called school committee or اللي هو مجلس المدرسة كويس أو بنسميه مثلا مجلس الآباء اللي هم parent committee, okay, or father committee. This is can involve in all activity or all services done in the hospital. So rather than be services can be a health related to the health or to the services for the school. The parent must be involved in all these activities. The other person share or participate in the school health, the community اللي هي providing suitable land for school building. Providing what? Suitable land for school building. The community, it is take a decision about about the school building, about the school site, about the school condition. This is decision taken by the community. There is a need school at that area. They are needed for that communities, are needed school for those families or those society or those community. This is decision can be taken by the community. Also the community providing funds and labor in building proper school. Yes, we see variation in our school. If the school built in the one community that characterized by the high or have a high level of the socioeconomic status, we can find a standard building, we can find standard environmental health. All this can be found by the community, because the community can provide the fund and provide the labor who is practice or can to adopt this practice. Participation in community, participation in the school health committees or counseling, and contribute in information of the school health policies and plan. Yes, the community have a main role in the decision or in the decision or in the authority of the school, have a main role in the decision or policy which is adopted in the school. Also the community must have a participation in the implementation of the program activity. There is many program activities can be done in the school. For example, اللي هي school activities. We find many activities done in the school. Plan of the school, and here غير التشجير اللي هي صيانة المباني تحت السكول. This is all can be by the community. Also the community motivating parents to send their children to the school and make care for their health. Yes, the community motivate the other part in the community to send their children to go to the school, to learn in the school, to go outside the home and to share in the learning process. The medical officer اللي هو the medical examination of the student done by the medical officer اللي هو ده طبيب المدرسة. بعد ذاك making diagnosis any student suffer from anything can be examined by the medical officer and take or put the diagnosis and treatment for them. Making referral for the specialties. If the pupil or the student have a big problem and need refer, this can be by the medical officer. Ensuring follow-ups of the children. Many children have chronic diseases as diabetes, mellitus, or as anemia or a cancer can be found in the school. This is followed by the medical officer. Intention promotive and preventing program. There is many programming done in the school as promotion health promotion in the school. That can be to learn the student about right brushing, about right hand washing, about right using of the bathroom. This can be promotive program or preventing program. The medical officer can share and can teach the student about the right method or the correct method to prevent or to promote their life. Also, the medical officer can inspection of the school environment and sanitation. Yes, can help the community to discover any potential hazard can affect the student health. Also, the medical officer holding meeting with the parent and teacher. If there is a pupils with a problem, this problem can be health problem or behavioral problem, can be solved by the parent and the medical officer and the teacher. The medical officers put this chance or create this chance or create this meeting between all this one, be parent, teacher and medical officer, to discuss and put a solution for the student problem. The medical officer share in ensuring maintenance of the record and report. Yes, this is normally any record of the school safe in the medical officer office. Evaluating the program and redefine objective and activity. Yes, because the medical officer aware about the health of the student in the school and the need of the health. For this reason, he can able to evaluate the program and to put another activity for the another objective for promoting the health of the school.